And good evening. This is Dr. MJ Collier, your host and producer and on-air personality of the Your Health is Important Facebook Live broadcast. We are coming to you live this evening, and we are here to talk about your healthcare questions. We have regulars that tune in, and if it's just your first time, I would like for you to also acknowledge that. So let's get right to those that have logged in and signed up. So good evening, Cheryl. We greatly appreciate you. Remember, tell me where you're calling or signing in from. And boy, that's two beautiful babies. Good evening, LaTanya Braggs. We are so glad to have you here as well. Great picture on your profile. We are loving it. Sabrina Washington, hello, and thank you so much for tuning in. Looking good, Sabrina. Sabrina, I'm sorry, I'm saying that incorrectly. Now I got it. Sabrina, I have it. Looking good, and we are so glad to have you. And all of you, Cheryl once again from Montgomery, Alabama. Now we're talking. We want LaTanya LaTanya Braggs is from Alabama as well. We want Alabama, Florida, New York, New Jersey, Chicago, Detroit. Janae Allen, good evening from West Palm Beach, Florida. Okay, we're moving down the East Coast now. And so now we want to go again, Midwest, Florida, LA. LaWanda Prather, good evening. It is so good to see you, Miss LaWanda. Watina Anderson from Philly. Watina from Philly. We love Philadelphia. Okay, Belicia Sarda from Cincinnati. Now we've got Midwest. Drea K. Line, hello, and hello to you, Drea. Annette Robinson from Baconton, Georgia. Now, I'm a native Atlanta, and I've not heard of Baconton, so very good. Thank you for tuning in as well. All right, LaWanda is from Chattanooga, Tennessee. We are so glad to have you tuning in. Okay, Nicole Hurt Beverly from Mississippi. Thank you so much for tuning in as well. Now we got North, South, East, and West. Natasha McClendon, also from Mississippi. We got the Mississippi recipients and representing quite well. Cynthia Thomas from Auburn, Alabama. Thank you so much for tuning in. And Chris Goodjoin from Greenville, South Carolina. Chris, thank you so much. Love that profile picture too, man. Love to be on that beach. Sean Big Time, my main man who is regular from Doc Monroe. So glad to have you here. Michelle James. Michelle, thank you so much. We appreciate you. Okay, Audrey Shanae, greetings from San Juan. Miss Ngalu is traveling, and she's in San Juan, Puerto Rico, but still catching the Facebook Live broadcast. B. Dukes from Washington, D.C. B, thank you so much for tuning in as well. Wade Lacey from Helena, Arkansas. Arkansas is in the house as well. Okay, Lisa Moore from Albany, Georgia. Thank you, Lisa. We appreciate you, and I hope all of you are listening to the morning broadcast on the Ricky Smiley Morning Show. Rachel Harrison, hello from New Orleans. We are so glad to have New Orleans in the house once again. Hey, baby. Shantae Washington Anthony, good afternoon from Atlanta. Our first Atlanta. There we go. Cher, always polished Clark. Thank you so much, Cher, for turning in. We appreciate that. Okay, listen. We're going to start off by talking about the big topic in the news, the monkeypox. The monkeypox. There are over 80 confirmed cases of the disease right now worldwide, with a total suspected number closer to 200. Cases have been reported in the United States, in Sweden, and Canada. In the U.S., we got one case of a man in Massachusetts and another case of a man in New York City who have tested positive for monkeypox. Now, normally, when people test positive for monkeypox, they have a history of travel to Africa. Neither of these individuals have a history of travel to Africa. And this is stunning virologists or viral disease specialists around the world. They've never seen anything like this. So what are the symptoms of monkeypox? In humans, the symptoms are similar to smallpox. Now, smallpox is a very substantial and significant infectious disease that we basically eradicated by getting your vaccinations in the 80s. They have the virus stockpiled right now in storage in case someone was to break out some smallpox and try to use it as a biological weapon. But at this time, we consider that we have eradicated smallpox. But monkeypox is a distant cousin. It's a little mild infection, but 1 out of 10 people that contract monkeypox still die. Now, that rate is higher than the coronavirus death rate. The coronavirus death rate is only about 1 to 2%. That's 10% for the monkeypox. So you have to be careful and conscientious about it. So you're exposed to the monkeypox. It takes from 7 to 14 days before you get sick. The illness begins with fever, headache, muscle aches, backache, chills, and exhaustion. You feel so tired. Now, one of the things that differentiates the monkeypox from smallpox is that the monkeypox causes your lymph nodes to swell. So you'll get swelling here. You'll get swelling anterior. You can get posterior lymph nodes as well. You can get lymph nodes under your arms that are swollen. You can get lymph nodes in your groin that are swollen. Remember, lymph nodes are just basically a part of your anti-infectious army that help fight infection. So lymph nodes will release B cells that help fight infection. And so they are like sponges that collect dead bacteria or viruses or dead infectious agents, but they can become inflamed and or infected. Sometimes they're overwhelmed by infection, and that's when they swell up, become swollen and tender. So then you'll break out in lesions that start off as macules. Macules are flat lesions that are different in pigmentation from your normal skin. They can be light, they can be dark. Usually they're darker than your normal skin, but they're flat. Then it becomes a papule, which means it becomes a raised lesion. You can feel it on the skin now. It is raised. It is a now lumpy, bumpy, as I like to say. Then it turns into a vesicle. This is a fluid-filled lesion that you're all familiar with if you've ever seen chickenpox or a herpes outbreak. Then that clear fluid becomes yellow and thick and pussy. So now you have a pustule. You go from a macule to a papule to a vesicle to a pustule. That will eventually dry up and scab over. And once the scabbing has occurred, you're no longer infectious. But most of the time, it is spread by coughing, sneezing, or breathing on somebody, being close to them. Then now a new level of intimate contact. So the illness typically lasts anywhere from 2 to 4 weeks. In Africa, again, the monkeypox has been shown to cause death in 1 out of 10 individuals. There's no specific treatment for monkeypox. However, there are antivirals that are used for other disease states that can treat it. And the smallpox vaccine will also protect you from the monkeypox. And so CNN and other news agencies reported that the CDC is going to release some of the stockpile of smallpox vaccine to treat at-risk or high-risk individuals that could be exposed to or already have the monkeypox. But remember, a vaccine protects you from getting the disease. It doesn't do you any good once you already have it. So the other antivirals then would be the way to go. So the monkeypox, there we go. Understand this. In this outbreak, they're seeing a significantly substantial number of lesions in the genitalia. And the predominant group that is being infected are gay men that have sex with men. So again, not exclusively. And this is not a gay disease proper. That just happens to be a group that is being infected. So we have to be careful, conscientious. And right now, it's in the news. It's not as big a problem as it potentially could be. But we have to be concerned about that. We also have to be concerned about the coronavirus. Coronavirus rates have increased 68% in the last 2 weeks. So we were not expecting to really have a problem with another outbreak until the late fall or winter. And as of now, we already have an outbreak. So we have to be careful. We have to be conscientious. We have to wash our hands. We have to wear our mask. We have to protect ourselves and not forget that the coronavirus still exists. People are still catching it. People are still being hospitalized with the coronavirus, and people are still dying from the coronavirus. Now, the people that are predominantly being affected by the coronavirus are people who have yet to have a vaccine. If you're not vaccinated, you're at very high risk. And if you are a high risk worker, you work in the healthcare system, or you even somebody that you're constantly exposed to, people stay at a Starbucks, you're a Starbucks barista, and you're seeing a lot of people and coming in contact with a lot of people. You need to be very careful and conscientious about that. Okay, it's your show. It's time to go to your questions and answer any question that you have about your state of health, about a medicine that you may be taking, about supplements. Winnie King, she says, I just purchased some more vitamins. I was wondering if I should add zinc and vitamin C. I hope my cholesterol is under control. Okay. Zinc at a dose of 30 to 50 milligrams per day is a great booster for the immune system, and also vitamin C at 1,000 milligrams per day. Vitamin C at 1,000 milligrams per day is a great booster as well. Neither of those supplements will lower your cholesterol. Omega-3 fish oil will help do that, and I hope that's one of the supplements that you got when you say you got your vitamins. If not, red yeast rice is also a good natural way to lower your cholesterol, and of course, the infamous low cholesterol diet. That means your preferred method of food preparation is baked or broiled, not fried. And again, you're limiting the amount of fatty foods. The problem with fat is this: fat tastes good. The best tasting foods have more fat. Ice creams, premium ice creams have 300% more fat than regular ice cream, which is why they're smooth and they melt in your mouth and they taste so wonderful and why we crave it. Fat is what gives food the best flavor. Your best steaks are marble. That means there's fat throughout them. So we have to make a conscientious decision to eat less in volume or less often, but you can still enjoy that. You don't have to be fat free. But your body does actually need fat. Your cells have a surrounding, the layer that surrounds the cells has a fat content, a lipid layer. And so it's important that you also have enough fat to maintain homeostasis in your body. Okay, great question. Next one. What symptoms for thyroid problems? Sean Schmicky Dylan. Well, thyroid problems are two types. One, you can have hyperthyroidism, which could cause a rapid heart rate. It can cause increased body temperature, weight loss because your metabolism is up. And most people, they are shy about stopping that problem. They like the fact that they can eat and do whatever they like and they still lose weight. It's only once they start to have an elevated heart rate and have a condition called tachycardia that the blood pressure can become too elevated and their heart can get tired and you can actually have a heart attack or a stroke. And they call this condition thyroid storm. Low thyroid or hypothyroidism, that's when you don't have enough thyroid. And the thyroid is your master gland. It is your thermostat. It controls your body's metabolism. So when you don't have enough of it, you get slow, you get sluggish, your brain is not as alert, you don't function as well, and you gain weight. So very easy to diagnose by simple blood tests. But oftentimes when you go to the doctor, some doctors will only do a TSH, which is a thyroid stimulating hormone screening test. Dr. Collier advocates a full and complete thyroid panel because that's what you need to find out what's actually going on with your thyroid. You can have a high or a low TSH and have a normal or abnormal thyroid function test. So the only thing that will happen if you get a TSH and it is abnormal, they bring you back for a full thyroid panel to find out what the problem is. So why waste that time, energy, and effort when you can get the information the first time? So a full thyroid panel would be a T3, which is thyroid 3 active thyroid hormone, T4, which is inactive thyroid hormone. Your T4 has to be converted to T3, and some people's body do that very efficiently. Other people's bodies do not, and so that's why they need supplementation with T3. And then I got a TSH, a FT3, and a T4 as a part of Dr. Collier's thyroid panel, and that gives you the most information. Great question, Ms. Dillon. Thank you so much. Okay, Stacy Brown. What's the best way to keep motion sickness at bay on a cruise? Your standard, I like the patches that go behind your ear. You need to place it at least a day before you board that ship, and that will help tremendously. They are actually available over the counter. Now they're called Transderm. The drug is called scopolamine. They also have that available in tablets, but the patch, you put the little disc behind your ear and you don't have to think about it and worry about it for the duration of your cruise. The patch lasts about 3 days. So if you're taking a longer cruise, and again, you're supposed to put it on about a day before you actually board, then you'll need a pack. And I think a pack has 4 patches in there. So that should get you through most of your travel. So great way. Enjoy your cruise. Don't eat too much. Don't walk on the boat and waddle off the boat, because the main entertainment on a cruise ship is eating. It's eating the great meals, eating the midnight buffet when we never eat that much. All of a sudden, you're going to midnight and you're taking in 2,000 or 3,000 calories and then going to sleep right on it. That is guaranteed weight gain and not what you want to do. Okay, next question. Is beet juice okay to drink every day? Beet juice is a wonderful supplement. It has a very good type of sugar in it, so it will help ease some of your sugar cravings. It has natural vitamins, A and B, all your B vitamins, all your C vitamins. So yes, beet juice is good if you like it, if you find it palatable. Also, a lot of people like beets in their salads, etc. Dr. Collier is not a beet person, but there are people that love them. So yes, if you like it, you can drink it every day. Great supplement for you. Next. Okay, Marlene Labradia Kennedy. Sometimes I get pain on the left side of my body, close to my left breast and above my waist. Do you know what this is? Any pain on the left side of your body is cardiac and to approve and otherwise, particularly if it's close to your left breast. The area of your heart, you take your hand and make an L shape like this. And then you put that hand under your breast and then lift it up. That is your heart. And so if you're having pain in any of that area, then you need to be concerned. You need to get evaluation, which would include an EKG, your blood pressure checks, etc., cholesterol levels. We want to make sure that there's nothing going on there. Once you've done that and you know that it's not your heart, then we're looking for other things. The only thing on the left side of the body is the left side of your colon, which is where the transverse colon translates or transfers into the descending colon. That stool has to go turn 90 degrees and go down. If you have solid stool in your transverse colon, then it should be semi-solid. That makes it difficult to move and pass. So that is an issue. Make sure you're drinking enough water, and make sure also that you go to the bathroom. You get the urge to have a bowel movement, that you go and have a bowel movement and don't wait. Ladies, you are very particular about where you do that. You do not want to do it unless you're in the comfort of your own home. You will hold it, and when you do, the stool gets drier and harder and more difficult to pass. So you want to make sure that is not an issue. We have a great product for that called LipoCleanse. It is not a laxative. It is not in a cleanse in the traditional sense. It is a fiber product that allows you to retain more fluid in your colon, and also allows you to pass large, easy to pass stools and keep your colon empty and your stomach flat. So the LipoCleanse product is available. Go to the website lipodrops.com and find out how the LipoCleanse, along with the belly pack, which includes the lipoprobiotics, that will help as well. Okay, great question. Drea K-Line, what can I naturally do for GERD? Natural foods, one, you don't lay down within 3 hours of eating, because that is the number one cause. We are eating later and later. In the good days, we used to eat at 5, no later than 6 p.m. in the day. Now, most of the time, most meals are happening at 8 or 9 p.m., and then that is a problem. And then you lay down on that food. So it's very important that you not do that. Foods that are spicy, foods that are acid, there are always foods that you know that when you eat them, they're going to come back and haunt you. It may be spaghetti, it may be pizza, it may be something. When that happens, then you know that you're going to suffer the consequences. So unfortunately, there are herbal products that can help with the GERD, and so you can get a consultation from an herbalist, or go to a vitamin shop or a GNC or someplace like that. But it's so easy to take medications now that used to be prescription that are now over the counter. Nexium is over the counter. Pepcid AC is over the counter. Pepcid is an acid blocker, an H2 blocker in the antihistamine class. And then you have what are called proton pump inhibitors in the Nexium line. And so that stops your stomach from making acid. The H2 blocker blocks the acid's effect in your stomach. They are not that expensive, readily obtainable, and will give you more relief than some of the other things. But there are natural ways to treat it, as you stated. So I would get a consultation at a facility like that, and just go online, Google natural ways to control GERD. If you have a condition called a hiatal hernia, this is going to be more difficult. And the hiatal hernia is when part of your stomach comes up into your chest. Everything above the diaphragm, which is your chest and your lungs, is a low pressure area. The purpose of that is that there's no resistance to when you're breathing in and out, and breathing is not work. Everything below the diaphragm is a high pressure area. That's so that pressure can mash on your intestines and help you evacuate your gut when it's time to do so. So when your stomach, which should be in the area of high pressure, which keeps the valves in your stomach closed, moves into your chest, there's no pressure to close that valve. And when your stomach, which contracts in 3 different directions when you eat food, it contracts in 3 different directions. And if that valve is not closed, then it will splash that acidic solution up into your esophagus. Your esophagus does not have a protective lining like your stomach does. Your stomach has a mucus lining so that it literally will not digest itself. Once you're above the stomach and into the lower portion of the esophagus, you lose that protection, and that acid will literally digest your esophagus the same way it digests a steak or any other piece of meat. So that can be unpleasant, uncomfortable, but it also can be life-threatening and give you a gastrointestinal bleed, or you get constant chronic irritation and inflammation, and that makes the lower portion of the esophagus scar down. So now it's not as flexible, so it won't close, but it also won't open. So you start to have problems with swallowing and food getting stuck in your esophagus. Sometimes you have to surgically dilate that. Other times you have to literally cut out the scarred portion because your stomach just won't work the way that it should. So great question. Great question. And GERD is a condition that everybody suffers from. Janae Allen says, I have hypertension and type 2 diabetes. So which Lipodrop should I purchase from your products? And I have diverticulosis. The great thing about the Lipodrops products is that it is perfectly compatible with diabetes and hypertension. There are no stimulants in the Lipodrops. There are no products in it that will make your blood pressure go up or your blood sugar increase or decrease for that matter. What the Lipodrops do is make you lose weight. And when you lose weight, you improve both of those conditions. Both are markedly improved by weight loss. But the decision that you have to make is how much you want to lose and how quickly you'd like to lose it. So we have the original Lipodrops formulation. We have the Lipodrops with mango, which is with African mango, which is a natural appetite suppressor. And a lot of people like that because they don't want to feel hungry. And then there's Lipodrops maximum strength, which you take, and it optimizes your body's metabolism of fat. Now, each of these products can be used 1 to 3 times per day. You squirt a dropperful under your tongue before your meals. You hold it under your tongue for 2 minutes and then swallow it. And then you get all the benefits from the Lipodrops product line. And that reminds me, I did not update you on my weight loss condition. I'm now down again. I have 3 more pounds to lose, and I was at like 5 or 6 more pounds. I was pleased that yesterday when I got on the scale, I'm down to only 3 more pounds before I'm at my goal, which it started off at 20 pounds, and now we're at 30 pounds now, and now I'm cruising in. I want to stay between 30 and 35 pounds. I am happy to report that I did full-fledged shopping yesterday and bought several wardrobes in a smaller size, more form-fitting clothes, slim fit, if you will. I have slim fit shirts now that fit perfectly, and your clothes should fit you in an attractive manner. And my clothes, after 30-pound weight loss, my clothes were billowing and not appearing inattractive. So, but you don't want to go out and buy new clothes or get your clothes altered until you see you're going to sustain the weight loss. So I feel pretty comfortable that we're going to sustain the weight loss. We're using the Lipodrops Maximum Strength. We're using the Keto Max capsules 1 twice daily. I take the probiotics every day anyway, along with vitamin D and omega-3 fish oil. So that is great. And when I found that portion control and the intermittent fasting option is what works best for me. I'm probably eating half of what I normally and traditionally do, but my stomach has shrank, and it's at the first feeling of satiety. In other words, when I start to feel full, I stop eating. I don't keep forcing it. I just embrace the fact that I'm full now, and it is not a problem. All of a sudden now getting there is the first 3 to 4 days up to the first week. You're going to be cursing Dr. Collier and saying, oh my God, he's got me eating like this. But remember, with the intermittent fasting, it's not necessarily how much you eat, it's when you eat it. And in the intermittent fasting plan, you can have 8, 10, or 12 hours in which you do all of your eating. Now, I don't think the 12-hour shift is that effective. I really think that the 8 is better, but some people, that doesn't work for them. They need 10 hours. But if you choose some 8 to 10 hour period per day to consume all of your food, you're going to lose weight and do better. Also, drink more water. Add at least 1 more glass of water per day. But if you think about it, if you drink a glass of water every couple of hours, you're not going to get thirsty. Oftentimes, thirst is misinterpreted as hunger. And so we'll get thirsty and we'll eat something, or we drink something that's a sugar, like a sugary soda, when we could just drink water and never get into that condition where we feel like we need it. So that's where we are with that. Great question. Okay, if your CT calcium score is 8, do you have to take cholesterol medication? That's the rapid CT. Your calcium score is a score that determines your risk for cardiovascular disease. You could take cholesterol medication. What would be more important is what your total cholesterol levels are and what your LDL and your bad cholesterol levels are. Your total cholesterol should be less than 200. Your bad cholesterol, the LDL means low density lipoprotein. That should be less than 100. So the total lipid panel includes the HDL, which is the good cholesterol, or high density lipoprotein. You would like for that number to be 40 or greater. The higher that number is, the better. The lower the LDL is, the better. and your triglycerides, which is another form of fat that can also put you at high risk. You can have a combination of all of those things being out of control, or you can have a unique just an elevation in your LDL or just an elevation in your triglycerides. Fortunately, you treat them basically all the same with too high triglycerides, so you may add omega-3 fish oil as your primary therapy, or other medications. For the cholesterol, statin therapy, drugs like Lipitor, Crestor, Simvastatin, or Zocor. All of those are the drugs that will lower your cholesterol. Again, all require a prescription, but are readily available. Okay, great question. Danietta Jones. What research is being done on long COVID system? I'm experiencing long COVID, have been tested, CT scan, etc. My doctor's at loss, and so are most physicians. What we're doing now, we're in the information gathering phase of long COVID. But what I can tell you about this, Daniette, is that all of the long COVID symptoms are caused by inflammation on the cellular level. Each of the arteries in your body is lined, they're kind of lined with a tile matrix called the endothelium. We thought this was just a covering, but what we found out is that the endothelium has an actual neurohormonal function, and it is the largest organ in your body. Each artery is lined with this, and you get inflammation in the endothelium, and you get all the problems that you get with long COVID. So how do you treat the inflammation? With anti-inflammatories. The number one most natural anti-inflammatory is vitamin D. Vitamin D at a dose of 5,000 international units per day, taken on a daily basis, will help decrease the inflammation. I also, again, recommend the omega-3 fish oil at a dose of a minimum of 2,000 milligrams per day. That would be, I'd split them up and take 1,000 in the morning and 1,000 in the evening. Vitamin D is omega-3 fish oil, rather, is an omega oil that is fat soluble. It is absorbed best with food. You don't have to eat when you take it, but just to make life simple and to get the maximum benefit from it, I recommend that you take it with your meals. So breakfast and dinner, or breakfast, lunch, and dinner, the omega-3s have so many great benefits. They help with your cardiovascular fitness, help decrease your risk for a heart attack or a stroke, help with things like arthritis because it decreases inflammation in your joints. So less swollen joints, less pain in your joints, all kind of, it's just God's gift to the human body, omega-3 fish oil. If you are allergic to fish and you can't take fish oil, there are other omega-3 oils that are available and ones that you can take that will give you the same or similar benefits. Okay, great question. Billy Sue Combs. Hi, Billy Sue. One of my regulars. So glad to have you here. I was waiting on an appeal for the camera peel. What does that actually mean? Okay, the camera peel is a diagnostic test where you literally swallow a large capsule that has a camera in it, and it takes pictures of your esophagus, the inside of your stomach, more importantly, your small intestines, which we don't have a way of taking pictures of other than this, and then the large intestines, and it goes, and then you pass it ultimately in your stool. But it takes pictures all the way down, and it really can answer some great questions about the condition, the lining of your entire intestinal tract. Remember, your GI tract is one long space. It's one long tube. It starts with your mouth, your esophagus, your stomach, your small intestines, your large intestines, your sigmoid colon, and your rectum. The name changes to protect the innocent, but it's all still one long space. You can have inflammation, irritation, ulcerization in any of those spaces, or sometimes in all of those spaces. Sometimes there are conditions like colitis and ileitis where your entire intestinal tract can become markedly inflamed. So that is the purpose of that test. You should have already had an upper endoscopy where they literally look down your throat with a tube, and a colonoscopy where they look through your entire colon with a tube. Regardless of what that status is, you would benefit greatly from taking an omega-3 fish oil and a probiotic. Those products are all available on the website, lipodrops.com. They were good for GI health, immune health. Absolutely amazing, the benefits that you can get from your GI tract. I would also recommend that you get blood allergy testing for food allergies. I had a patient today in the office that tested positive for food allergies to every nut that exists, to milk, to wheat, to beef, chicken, pork, shrimp. They were testing positive to virtually every food that they eat all day, every day. And I say, amazing that you have a patient that does that. And when you avoid those foods, or at least don't pile all of them on all day, every day, then you will find that your GI tract functions more efficiently. You don't have bloating, you don't have problems with constipation or diarrhea, and your stomach will just become flatter. You'll lose that abdominal fat, which is a function of inflammation in the gut. So again, probiotics, amazing as far as GI health is concerned in addressing the condition called leaky gut syndrome. That is where the lining of your intestine, which has a filter-like function to keep certain proteins out of your bloodstream, breaks down. Those proteins into your bloodstream, your body recognizes them as foreign, meaning not you, and you start to reject that tissue just as you would if you got a heart transplant or a kidney transplant or even a blood transfusion that didn't match and was the wrong type. Your body rebels against that. So imagine that, most of the foods that you're eating are breaking through that barrier. They're irritating and activating your immune system. It's now your body's in a constant state of inflammation. This increases your risk for a heart attack or a stroke. It makes you gain weight. The amount of energy that it takes to fight that inflammation zaps your energy for everything else. So you're tired, fatigued, have no energy, no zest or zeal for life. Your libido goes down. You don't have the energy for routine and good sex. It's a problem. So it's a great problem. So I would highly recommend that you, no matter what the diagnosis is, the symptoms that you're having that require you to get that test, you'd benefit from probiotics. Great question, Billy Sue. Are vitamin D and D3 the same? Well, vitamin D comes in two types, vitamin D2 and vitamin D3. Vitamin D3 is the active vitamin, the one that your body needs. Now, you can take in vitamin D2, and most people will actively convert D2, the inactive formulation, to D3, the active and the nutritious formulation, and get all the benefits from it. Some people's body do that very well. Most people's body do that very well. But some people's body doesn't do it well at all. And a lot of people's body doesn't do it, period. So they get D2, but their D3, which is what they need, levels never go up. So cut out the middleman. Make sure that the vitamin D product that you're taking is vitamin D3. The doses are the same. A daily dose of 5,000 international units is the optimal dose. The recommended dose by the FDA is only 1,000 milligrams. And that gives you just barely enough. You want more than enough. You want to be optimal. And to optimize the function of your immune system and to get all the benefits of D3, which is strong bones, strong teeth, a variety of other things, you need a better dose. And so a better dose, and one that's recommended by people that understand vitamin D, is 5,000 international units per day. Prescription strength is 50,000 international units per week, one tablet per week. So I will oftentimes take patients that have a substantive vitamin D deficiency, place them on the 50,000 international units per day for maybe 3 months, build their vitamin D level up. The normal range for vitamin D is 30 to 90 nanograms per meal, 30 to 90. Most of the people that come into my office have vitamin D deficiencies. Their vitamin Ds are 10 or less. This is incredible. This is amazing that they're walking around and not having problems with bone fractures, and the immune system just isn't working, so they're sick all the time. So you boost that up with the 50,000. Once I get them higher than 40 to 60, then I can maintain them on 5,000. Ideally, you want it to be between 60 and 90. That is when you have optimized your immune system function, and also you get the benefits of cancer prevention, and that is breast cancer, colon cancer, cancer of your female organs for women, breast cancer for men, actually, colon cancer, pancreatic cancer, prostate cancer for men. Vitamin D is the primary therapy. When a person gets a cancer diagnosis, it's the first drug they put them on that's, quote, natural. But why catch it and then try to, it's too late at that point. And what you may get is a prolonged life and an opportunity to make the cancer not as bad over time, but be preventive. We always talking about prevention. The vitamin D at 5,000 international units will help prevent and decrease your chances of becoming a cancer patient. All right, great question. Cynthia Thomas, what's the best way to treat lupus SLE naturally? That's a systemic lupus erythematosus. That's what the SLE stands for. This is an autoimmune disease that causes inflammation of the skin, the internal organs, the eyes, the face. Oftentimes you will get attacking the skin, and it will lighten the skin, give you a hypopigmentation above the eyes and below the eyes, and it gives you a pattern that's called a butterfly rash. It can cause alopecia or loss of hair. Again, this is a disease condition that disproportionately affects women, disproportionately affects women of color. But I actually have a Caucasian male in my practice right now who has lupus. And when I told him, I said, this is a diagnosis of exclusion. There is no lupus test. There is no test that makes you say, okay, it's positive or negative. No. Basically, you ruled out all the other things that it could be, and your sign symptom complex comes together and says, okay, this is what it is. We're going to call this lupus. And then you treat it appropriately. The great thing about that is the most common therapies are steroidal in nature. And then, problems with steroid therapy, particularly chronic steroid therapy, is you can it makes you gain weight. You can get unusual weight gain in your face, what's called a moon facies. It also can bring out diabetes or make diabetes worse. You could be non-diabetic, go on steroids, and it makes you diabetic, or it activates a diabetic process that was predetermined or underlying. Or it can make, if you already have diabetes and you go on steroids, make your diabetes much more difficult to control. So natural ways, again, natural anti-inflammatories, vitamin D, omega-3 fish oil, curcumin, turmeric, listing. I would take every anti-inflammatory that is natural. Turmeric, it comes in capsules, it comes in tablets. You can make tea out of it. It is absolutely incredible. But it's very important that you use those things in addition to, not instead of. When lupus attacks your heart and your lungs, this becomes a problem. When it attacks your kidneys, called lupus nephritis, this is when your life is being threatened by the disease state. So you, at this time, you partner with your primary care physician and your rheumatologist to stay on top of this. Make sure that you take the medications as you're supposed to continuously. Don't take breaks from them. I had a young college student who had lupus nephritis, very good control on steroids, but the steroids made her gain weight. Her boyfriend complained about her gaining weight. Her college boyfriend, remember, this is just a boyfriend, not even a husband, complained about a weight gain, so she stopped taking the medication and she ended up in the hospital. So this is a problem. It's a real problem. Nobody wants to gain weight, particularly if it's settling into your face and giving you a distorted appearance. You don't want to do that. So it's a combination of those things that your doctor may prescribe, those things that are natural. There are good ways to do that, but it requires a partnership and a continuous partnership. There's no cure for lupus. You can only control the symptoms. So you and your physician need to be good friends. If that is not the type of relationship that you have, you need to change providers and get somebody who you feel comfortable with, that you can work with. All right, great question. Marcia Smith Nesbitt. Hey, Marcia, glad to have you back again. How much weight should a man lose on average with Lipodrops Max? Okay, I hate to tell you ladies this, but men lose weight across the board much easier than women do. And I will see men double the weight loss of a woman. I would imagine that, again, if you're using Lipodrops and you are following either the eat 5 times per day weight plan or the intermittent fasting weight loss plan, then the minimum that you should lose is 1 pound per week, 5 pounds per month. But it's easy to double that without question using these products. That is our objective, and we always, not always, but the vast majority of the time exceed that weight loss goal. When we rarely do, upon question, the person will say, well, yeah, I started to lose weight, so I started to eat more, or I was celebrating a little too early, or whatever. I'm not doing anything to burn calories to stimulate your metabolism, or there's some other reason that they may have difficulty losing weight, like thyroid disease. So that's when it's necessary to do a more intense evaluation. But the success of LipoLine, anywhere from 5 to 10 pounds per month. If you use other products, you can increase that 15, 20 pounds per month. And that's why I tell people weight loss is a couple of things. Number one, how much you'd like to lose. Number two, how quickly you'd like to lose it. And everybody wants to lose it yesterday. And number three, how many products you want to take to accomplish your objective. So I tell patients all the time, we can get you ready for your class reunion. We can get you ready to be a bridesmaid in the wedding, or the bride, or the groom for that matter, because gentlemen want to look good in their finery as well at a wedding or some gathering like that. But the biggest two are weddings and class reunions. Those are the ones that people want to get ready for. Or sometimes, I'm going on a cruise. I'm going to my class reunion or my family reunion. I want to be the best looking person there. We can do that for you. We can do that for you. And, you go to the website, lipodrops.com. You see what it is. You read about the information. It tells you and recommends based on what your objectives are, what the best way it is to accomplish your objective. All right. Great question. Sally Strickland. Doctor, Olympic has made me super constipated. What lipofiber medicine did you suggest? The lipo cleanse will help with that, but you also need to make sure you're drinking enough water. Ozempic is an absolutely amazing weight loss product. Some people have diarrhea. Some people have constipation. I've seen patients with both extremes. So if you see that it's causing you to be constipated, you want to at minimum take a stool softener like a Collier, which will make it easy to pass. 1, drink enough water. 2, take a stool softener like the Collier. A fiber product such as the Lipo Cleanse or products like FiberCon, Metamucil. You can also do it naturally. Crunchy fruits and vegetables are very good for that. Everybody has a food that they know when they eat it, it helps clean them out. It may be spinach, it may be cabbage, it may be prunes, it may be grapes. Grapes are so high in fiber that if you swallow one whole, it would literally come out and be floating in the toilet undigested because there's nothing but pure fiber. So fruits and vegetables, God's gift to humanity, are very good. But the main thing, again, ladies, you don't like to use the bathroom away from home. When you get the urge to go, you have to go. You cannot hold it until you're in the comfort of your own toilet. If that means carrying around toilet wipes and Clorox wipes and whatever you need to do, line the toilet with multiple layers of toilet paper to protect your precious bottom, but do not wait, because after a few minutes you will lose the urge to go, and you won't get the urge back until you have another meal. And that may be lunchtime or it may be dinner. But in the meantime, the colon does not stop doing what its main function is, which is reabsorption of fluid. So now stool becomes drier and harder and more difficult to pass. And so once that cycle is placed, it becomes very difficult to maintain good bowel habits. So again, staying hydrated, making sure you're drinking enough water, crunchy fruits and vegetables, or another fiber source such as the Lipo Cleanse product, or things like FiberCon, Metamucil, etc. Going when you get the urge, and that will take care of that. But the Ozempic will definitely get weight off you. It is the latest, greatest. But the diet, you have to be diabetic to get the Ozempic. If you are diabetic, ask your doctor about the Ozempic, because it will control your diabetes. It will lower your hemoglobin A1C, and it will literally make you lose weight. It's absolutely amazing. I've been made aware that at least 3 other products in the pipeline that work as well or better, that we can look forward to in the next few months, because this is going to be, the great weight loss year for us. Everybody's going to be using these products to get their slim trim high school sexy back. And believe me, they do work and they're safe. So you can utilize those as well. Great question, Sally. Annette Robinson, what causes a numbness on my left center thigh? Okay, left center thigh. That could be actually the problem is in your back, the nerves that come from your back. So you probably have a bulging disc, a ruptured disc, or even sciatica. Stretching exercises, range of motion exercises for your back would help with that tremendously. But I have this conversation with people. Numbness is actually a minimal symptom. It could also be pain. It could be stabbing pain. It could be burning pain. It could be like somebody has a knife in your thigh. And I tell patients, I say, they say, my leg is hurting. I say, it's not your leg. The problem's in your back. Can you give me a shot in my leg? My leg is hurting. It's not your leg. It's in your back. And it's hard to appreciate that the pain is being referred from branches of nerves coming out of your lower lumbar spine, but that is indeed the issue in the case. So you have to make sure good treatments would be anti-inflammatories. Start off with something over the counter like Motrin, Advil, Aleve. Get to know your friendly neighborhood chiropractor. They may be able to adjust this, and you may have to go, say, 3 times in a week or a couple of weeks to get the maximum benefit, and then once or twice a month for maintenance after that. The amount of relief that you can get from having your spine adjusted is unparalleled. Dr. Collier, I have personal experience when my back, quote, went out and I literally could not move. And I have a patient that's a chiropractor. He came to my office and adjusted me, and literally within minutes, I was 100% pain-free and going from pain that was, on 10 plus out of 10. So at that, I became a true believer at that point of chiropractic adjustment, and I highly recommend it for all of my patients. So again, you can go on the internet and do range of motion exercises for lower back, find some exercises and do those things. And don't just do them when you're hurting, do them all the time so that you don't hurt. You keep your back in optimal condition. Also, if you're working at a desk, and from your profile photo, you look like you're an executive person. Be conscientious about the ergonomics of your work spot. When you're working on the computer, don't hump your back over and lean over. That puts strain on your lower back. Make sure that your chair is adjusted to the appropriate height and that you are close enough to and you make sure your legs are underneath the desk and that you're close enough to your keyboards so that you can work in a comfortable position. Always be conscientious about standing straight, your shoulders back, stomach in, chest out, so to speak. That's the best posture to maintain good health. And then at night, do not sleep on your side. That is the absolute worst posture that you can have, and always results in problems with your lower back and sciatic pain that could go all the way down to your feet. So great question, Annette. We appreciate that. Camille Peak. Camille from Ohio. I just had my first colonoscopy. Wasn't that fun? Okay. I was just diagnosed with diverticulitis. I really don't understand this disease or what I need to do. Okay. Diverticulitis is a condition of inflammation of an extra finger-like projection that's usually on the large intestine, but can be anywhere throughout your colon, where the arteries come into where the arteries and blood vessels come into the lining of the colon to provide it nourishment. Those are weak spots in the wall. And so when you sit down on the toilet and go and put that pressure on it, you can literally blow out a finger-like projection that looks literally like your finger hanging off of the colon. You can have one of those. You can have 100 of those. There's a genetic predisposition that people can have a condition of diverticulosis, and they're everywhere all over their colon. And they act and can be just like an appendix. If your appendix gets inflamed, you get appendicitis. When your diverticulum gets inflamed, you go from diverticulosis, which is condition of, to diverticulitis, which is inflammation of. And nowadays, the predominant therapy is antibiotic therapy when it flares up, but then the objective is to keep it from flaring up. So fiber, don't eat things that can get trapped in the diverticulum. Don't swallow watermelon seeds. Don't swallow whole peanuts. Those are things that are no longer part of your diet. Big crunchy fruits and vegetables that will give you large, easy to pass throughs are your friend. And things that are hard to digest, like big, thick steaks are very difficult to do so. Make sure that when you chew your food, that you chew it thoroughly so that it's easy to digest and there are not chunks of food that can be trapped in the diverticulum as well. So this is a lifelong condition. If it becomes too inflamed, sometimes they literally have to cut out that segment of the intestines, and so they usually can reattach the two other ends and bring it back together. But who wants that type of surgery? If you can avoid it, you don't want it. But that's the end stage if it gets, or if it ruptures. A ruptured diverticulum is a medical emergency, because then you literally have feces being deposited directly inside your abdomen, and it causes severe infection, inflammation, and it's life-threatening. So it can cause sepsis, blood poisoning, etc. So you want to be very careful about that. But again, they make that diagnosis now with the test like the colonoscopy. They can also do it with an MRI, and then treat it again with antibiotics when it flares up, and then a special diet to keep it under control. But you have to be conscientious about this forever, because it can flare up at any time if you eat the wrong foods. But you can literally do everything perfectly right, and it still can flare up on occasion. But you want to give yourself the best shot at that not happening. Okay, great question. How is lumbar spinal stenosis diagnosed? I've been reading about it. Okay, Makiva Bolin, thank you so much. It's so good to see you, Miss Bolin. And spinal stenosis is diagnosed with an MRI, and what it looks at is how the tunnel inside of your spine is where your spinal cord is, and that the spinal cord should be free floating. It should not touch anything. It is very, very sensitive, and if a bulging disc or something touches the spinal cord, it can cause excruciating, lightning like 10 plus on a scale of 10 pain. It can cause numbness, It can cause paralysis if that happens. So most of the time, as you start to get inflammatory changes in the spine, usually arthritis, it can be arthritis as a result of aging. It can be arthritis or inflammation as a result of an injury, like a car accident. It can happen. And I'm seeing lots of cases of people that are getting stenosis of the cervical spine. This is highly unusual, but it's happening more and more. And I'm getting more people that are being diagnosed with it. And so if it's of the neck, it gives you signs and symptoms in your hands and arms. If it's in your lower back, it gives you signs and symptoms in your legs. And so those symptoms, again, weakness, numbness, tingling, pins and needle sensation, burning, literally as if it's on fire. So the discomfort can be mild to minimal or excruciatingly painful. They go in now. In the good old days, they used to literally take a hammer and a chisel and chop open an opening or widen the inside of the spine. Very, very difficult surgery to do, and oftentimes people would have poor outcomes, including paralysis. But now they can use a laser and go in and do it. They have some special surgical instrumentations that can literally grind down and open it up. And I've had patients that are getting these surgical procedures and doing amazingly well. Again, Dr. Collier's mantra used to be, nobody's operating on my neck or my back unless, 1, I can't walk, 2, I can't control my bowel or bladder, 3, I cannot obtain an erection and function in the way that a man's supposed to function. That was my criteria. If it was just hurting, then you do physical therapy, you take pain medications, you take anti-inflammatories, you do whatever you need to do to keep that pain at bay. But I was not getting surgery on any of those situations. But I'm seeing that surgical options are now getting much better outcomes. The technology and the science has improved tremendously. And they're even doing Band-Aid surgery now. They have lasers that are as thin as the inside of a pen, an ink pen. They can create a small hole, go into the area, zap it with a laser, which literally vaporizes the tissue immediately. Pull it out, put a Band-Aid on it, you're pain-free instantly. I mean, it is incredible where we are now with back surgery. So some people are not eligible for that type of surgery. It just depends on whether you have degenerative disc disease, degenerative joint disease, collapse or ruptured disc, or just inflammation in the spine. So all of those things will determine it. But before you get that surgical option, you have to find a doctor that actually does that surgery. The great thing about surgeons, or the bad thing about surgeons, depending upon your perspective, is they learn how to do something one way, and that's usually how they do it throughout their training. And so they may not have learned the newest, latest, or greatest, or they may not work in a hospital system that is spending money on the newest, latest, greatest laser technology, because most private doctors cannot afford that equipment. Most of it is, very, very expensive. We're talking about millions of dollars. So hospitals buy it, doctors use it, the hospitals charge for it. And so that is how that system can work. But you have to have a doctor that's been trained in how to do it that way. Otherwise, they're only going to offer you the techniques that they know how to do. They're not going to say, well, I do it this way, but there's a much better way to do it now. So I'm going to refer you to my good friend, Dr. XYZ. That doesn't happen. They'll say, well, recommended the way to do it is this, and that's just not necessarily bad. If they've been doing it a certain way, they have an expertise in doing it that way. They have a lot of experience in doing it that way. They've done hundreds, possibly thousands of these procedures. Then that also might be a good way to go. But look at all your options. That's if you have any surgical procedure scheduled, look at all your options and make sure that you're getting offered the absolute latest technology that's available to do that. All right, great question. Okay, how long should a person take prednisone? LaWanda Prather, great question. It depends. Some people have to take it and stay on it all the time. I just had a patient who had been on it. They just took a month-long drug holiday, is what you call that. And then we restarted it yesterday or Monday of this week after giving them a break from the prednisone. And now they're starting back at a relatively low dose. You can do that. You can stop it. And then if the condition flares up, you can start off with a high dose and down titrate. In doing so, there's a thing called the Medrol dose pack it has a week's worth of medicine in it. You take 7 pills day 1, 6 pills, 5, 4, 3, 2, 1. In that way, they're laid out on a card. It's very simple to do. But some people are taking prednisone, for instance, patients with lupus. They have to take people with bad asthma. People with a variety of different autoimmune diseases, they have to take the prednisone on a daily basis. And so if you need it and it is benefiting you, then you take it forever. There's no necessarily time that you would stop taking it. If you're having complications, if it's causing you to have problems like new onset diabetes or difficult to control diabetes, etc., then you might have to take it in what's called pulse dosing, which means you take it until your symptoms are controlled, then you stop taking it and you resume it once the symptoms are controlled. And if you're taking other things, other natural anti-inflammatories, avoiding those triggers, whatever they may be, that make your condition flare up, maintaining your weight, getting enough rest at night, decreasing the amount of stress in your life, all of those things very important for those types of disease states so that you can decrease the intensity and the frequency of flare-ups. Okay, great question. What is good for gout? Miss Antoinette Gross. One, most people have foods that they eat that will cause a gout flare. Barbecue season is very important. Grilled food, sometimes it doesn't matter whether it's a steak or chicken or pork ribs or whatever. The grilling technique itself makes people have a gout flare. Uric acid is the problem with gout. It is a byproduct of muscle metabolism, so it is in your muscle meats. So if you eat, you normally don't eat the way we do on holidays. So after holiday, and I fully expect the week after Memorial Day, the next few days, I'm going to have people having gout attacks. I always do after the 4th of July. One, because it's hotter. Most of the time, the 4th of July, we're outside, so people get dehydrated. They don't drink enough water. The uric acid gets concentrated, and it comes out in the joints. The most common joint is the bunion area of the big toe. The pain is excruciating. You can't walk on it. You can't touch it. It's 10 plus out of 10 level, but it can affect any of your joints. The next would be ankles, knees, etc. But the most common, 9 out of 10 times, is that joint of the big toe, usually on the dominant foot. So if you're right-handed, your right foot. Why? Because that's the foot that you take your first step with and your last step. So it's your brake and it's your starter. So it pushes you off. It has more trauma and more stress than the non-dominant foot. So that is why it's most common. But it can happen in both feet. Rare, but it does happen. Fortunately, there are medications that will give you almost instant and immediate relief. There's a medication called colchicine. You take 2 tablets immediately and 1 tablet an hour later, and within hours you're pain-free. And then you continue to take that. Then you take another medication that keeps your uric acid low. There are several. It's one called Uloric, one called allopurinol, all variations that make you urinate out the excess uric acid so it doesn't build up in your bloodstream and cause you to have gout. So there you are, Antoinette. Great question. If a spot was in your lugs, should you worry? Carol Laster. Hey, Carol, how you doing? It's a pleasure to see you once again as well. Should you worry? No. Should you watch it? Possibly. It depends on a variety of things. Because the technology is so good now that everybody's getting spots on their lungs, or depending upon the whim of the person reading it, the radiologist, he may call it a spot or not call it a spot. But there are several other determinants: how big the spot is, where it is located. Is it more than one spot? All those are things that give you a higher level of concern when doing so. But if it was found on a CT scan, they're always going to recommend that you get an MRI. If it was found on an MRI, they're going to recommend that you get a CT scan with and without contrast. And then if it's really of concern, the only way to make and answer the question is to do a biopsy of the spot. So that is a very dramatic and traumatic way to obtain a diagnosis, but it can be done and should be done in some circumstances. So I hate that I have to give you such a wishy-washy answer, but it depends. And so at minimum, I would watch it, repeat the radiologic scan in 3 to 6 months, see where we're going. But if you have a history of smoking, if you have a history of working, like say in a cotton mill or someplace where you've been exposed to asbestos, then that will require another pathway and a more aggressive pathway. If it was just found intermittently, you're not having any problems or symptoms. Primary symptoms I would be concerned about would be persistent cough, shortness of breath, wheezing, coughing up blood. That's a whole nother level, and then I'd be much more concerned. But if it's there, if you happen to have previous tests that nobody called it, you look at old films and say, oh wow, that was there for the last 20 years, and they never decided to document it. And so, but it's there and it hasn't changed, and that's what you want to document: change in the lesion. Okay, all right, we're coming out to our final question. What's the best cure to treat for lymphedema?
One, basic lymphedema, just swelling if it's caused by gravity, low salt diet, compression stockings or socks, depending upon how high the lymphedema is, and making sure that you're, believe it or not, most people that have this problem don't drink enough water. If you drink more water, you will be diuresed more and you will lose the fluids. But lymphedema is again a chronic condition. At its worst, it can be very difficult to live with. It can be on both sides of the body. It can be on one side. It can be disfiguring. It just depends. It was a consequence oftentimes of surgical procedures such as old school mastectomies, because they would take off the breast and the lymph nodes, and that arm on that side would always swell up and be disfigured. So now we're doing much better job with that and not having to take lymph nodes. We're doing lumpectomies instead of mastectomies, just removing the cancerous lump and then maybe doing some radiation and or chemotherapy to totally eradicate the cancer. So this brings to a close this episode of the Your Health is Important radio and Facebook live broadcast. It is my pleasure to have had you as my guest. Thank you so much for tuning in. We are here every second and fourth Wednesdays at 6:30, and listen to me every morning on the Ricky Smiley Morning Show. I am the medical consultant, and we always have a great topic for you. So tune in, and you can always call in and ask your healthcare questions. Good night, and thank you once again.